I'm live. Good morning. Good morning, all. Welcome to this brief talk on the recent announcement by the Honorable Prime Minister indicating that St. Kitts and Nevis have increased its restrictions in relation to the new outbreak of cases related to the COVID-19 virus that has taken us here in St. Kitts and Nevis. I want to begin by reading a short statement, an explanatory statement that will set up, as it was, this short talk to explain what is going to happen over the next 2 weeks. The government of St. Kitts and Nevis is seeking to take a phased and proportionate approach to addressing the COVID-19 pandemic. Since we anticipate that the pandemic is a long-term problem, the proposed approach, therefore, seeks to strike a delicate balance, and it allows for more movement than would be normal under a strict lockdown. This approach, however, may be adjusted to either tighten or to reduce restrictions dependent on the level of effectiveness of the measures when they are put to test. We will continue to seek to refrain from exceeding the necessary levels of restrictions as we fight the virus. What we are hoping for is for our people to adapt and adjust to actually living and producing despite the pandemic, and this cannot easily be achieved under full lockdown conditions. If we must go to full lockdown to save lives, we will if circumstances compel us to do so. We must, however, continue to strive as individuals and as a nation towards normalcy. We are all in this fight together, and we must learn to govern ourselves, to live and work in the midst of a pandemic. The people of the Federation of St. Kitts and Nevis are a resilient people, and I remain fully persuaded that we will in time be able to surmount this obstacle. I want to have us remember where we are today. Some 3 to 4 weeks ago, we learned that there was a cluster of cases of the pandemic. We in St. Kitts and Nevis have for more than a year been very proud that we have been able to manage the COVID pandemic that had been circulating around us. And we recall that it all began for us on the 25th of March, 2020, when we learned on a Wednesday that 2 of our nationals had returned to St. Kitts and had been diagnosed with COVID-19. The government took a very quick and aggressive action, and so by the Saturday, on the 28th of March last year, we locked down. Lockdown in that circumstance, at that time, meant that we closed the borders to international travel, and regular air flights could not come to St. Kitts. We introduced certain restrictions in which From time to time, we did not move from home at all. There was a 24-hour lockdown, but there were times our lockdown was less restrictive, so that we had curfews, and we had curfews that sometimes went all night, sometimes through the night. But the two things were mutually exclusive. We, at that first closing of the borders, and what we learned was a lockdown, we asked, or the Prime Minister asked His Excellency, the Governor General, to declare a state of emergency. And so in the first instance, His Excellency would have had a state of emergency for 2 weeks, 14 days. That was later extended by a resolution of the Parliament, and we lived with the state of emergency until the end of 2020, December 31st, 2020. During that period of time, we learned many lessons. We learned how to restrict movement. We learned how to open gradually. And we tried to train ourselves to learn behaviors that allowed us to live and to have some livelihood, to earn a living. And over the past year, we have been able to get to a point where it was done so effectively that many of our citizens felt there was no COVID here, that we did not have to continue to live in a certain manner that we thought was restrictive. The wearing of masks was one restriction that we were advised by our medical experts was critical to our living, because the COVID pandemic, the COVID disease, the COVID virus was transmitted from one person to another when you came close to that person. You breathe the same air. You were in a mass gathering with each other. And so the wearing of masks is critical. And the wearing of masks will be with us for some time. It is now part of the new normal. We have been able to let you know that we will not tolerate people in the public who are without the mask. And so we have created regulations that allow our security forces to issue a penalty if you are without a mask. We have said that there should be social distancing, physical distancing, because when you come close to each other, there is the potential for that spread. We can breathe the same air, and we can exchange as it was. Those who have it can transmit it to those who do not. So social distancing, physical distancing, we insist upon. We have said that you should sanitize constantly. They are sanitizing fluids that should be administered if you get into a bus, you get into a vehicle, if you enter an establishment, an institution, if you go to church. And for the most part, many of us had adhered to that until we felt no COVID here. The sanitizing, the wiping down of doorknobs, of surfaces where the virus can linger, is critical and important. These were non-pharmaceutical measures which were critical to us. And if adhered to, would have been able to continue to protect us. But we have been careless, and many of us have dropped our guard. We indicated that the advice of our medical professionals was that we keep these non-pharmaceutical restrictions, these non-pharmaceutical tools, protocols in place until we were able to get the ultimate in our protection, the vaccine. The WHO and other international bodies that we subscribe to have indicated that the vaccine will protect us, will protect our families, will protect our country. The vaccine, when taken, will reduce the risk of all of us from contracting the disease. The vaccine will not necessarily completely protect all of us from getting that disease. The very limited number who may contract the disease, if you have the vaccine, will allow us to not get seriously ill. We will not go to the hospital. And God forbid, we would not die. The vaccine, then, we believe, as we have been advised, is the best tool in support of the non-pharmaceutical tools to keep us safe. If you do not take the vaccine, you have the potential, a higher risk of getting ill. You have a higher risk of going to the hospital, and you have a higher risk of dying from COVID-19. We believe that our country must take this vaccine. And as we go forward, we encourage, we urge, we appeal to all of our citizens to ensure you take the vaccine. In January, we removed the state of emergency, but many of our restrictions still persisted. We wanted you to continue the non-pharmaceutical protocols. Our health team advised that we should maintain our control of mass gatherings, because when people come close together, there is the potential of the spread of the virus. Today, we are here because a few weeks ago, we learned that one of our citizens had contracted the virus. That citizen came forward, or was discovered, some days after she had been obviously infected, and there was transmission. The transmission of that virus has spread through our society. And our health team, our health professionals worked very hard to track those who had come into contact with those who were tested positive. They were quarantined. If they were found to be positive, they were isolated. And this exercise has been going on robustly. Approximately almost 1,500 people have been so tracked, have been so tested. And we did our very best to see if we could contain it. Some 6 schools have been tested, students of those schools, and we are happy to note that they had been cleared, that it did not get away in the schools. But we also note that it had been spreading in business establishments. And in the news, we have learned of some businesses and certain types of businesses where there has been spread. These experiences have guided the Prime Minister and his cabinet on the advice of our medical fraternity to now revisit these restrictions. Because despite our very aggressive tracing, despite our testing, widespread testing, diagnosis, and where possible, quarantine and isolation, we see that the virus has spread. And we need to reset our country to get hold of it. And so, we determined that we would lock down. What does this lockdown really mean? There are different levels of lockdown. As I said last year, the borders were closed. Regular airlines could not come. We had to stay at home. But even with that strict lockdown, planes did come. Every week, FedEx, cargo came. Every week, ships came to our borders because we had to survive. They brought goods. Certain services were critical. We were in a total lockdown. In addition to that, in our society, for it to function, some people had to leave their homes. Those who worked at the airports and the ports, generally. Our security forces, our medical staff at the hospital, they moved from their homes. These were essential services. If the electricity went down, the workers at Skelec had to leave their homes at all hours of the day and night. So there was a lockdown, but there was movement, restricted movement. For those of us who did not have to perform critical and important duties in our society. But we had to eat. We had to go to the supermarket. Some of us may not have the facilities at home to store food for a week or even for 2 days. So we had to leave home to get something from the shop. Many of us had to change our behaviors. But there was an understanding that all of our citizens had to function in this very strange way. We had to get bread. Many of us love bread. And so the bakery had to function. And the other services that could not be eliminated. We learned all of that last year. And we had to put restrictions, guidelines, regulations. We call them SRNOs, the official gazetting, under Emergency Powers Legislation, the Act. Under the state of emergency, they guided our behavior. So we know from our experience last year that you can lock down, but you can still move. Those who have to, those who must move to keep our society going. And even with the lockdown, even with the state of emergency, we had curfews. Sometimes we went all night. We reduced it as we understood, people understood. There was a easing of this restriction. They coexist. A curfew is a form of lockdown. It says do not move. Stay home. Stay off the street. But some people had to police it. And those essential services that I mentioned earlier still had to function. We had to go to the hospital, and the nurse had to be there. And I can go on and on. You can have a lockdown, and you can have a curfew. There are different levels of lockdown to create the environment that we want. Over the past week or two, the medical team has seen that with all the very hard, arduous, and difficult work that they do, that maybe we need to be more restrictive, because there is the continued transmission. And I said earlier, we have seen it in business places, in gaming establishments, stores. So, as the numbers persist, as we have not yet reached a peak, we have not been able to flatten this curve and reduce the cases, make the cases fall. The Honorable Prime Minister, with advice from his medical experts, the medical team, meeting with his cabinet, has determined that we should be more restrictive. And so we ask for a lockdown, a reset. And it's very simple to understand what it is. When people move and come into contact with each other, they're not wearing masks, they're not sanitized, then we find that the virus spreads. And so we are asking to restrict the movement of people, and that movement of people will only be for essential, for emergencies. And they're very simple. If it is that the someone is at home and you need to get food, you are allowed to do so. And just like last year, when supermarkets functioned, the supermarkets will be allowed to function between the non-curfew hours. Pharmacies are essential to those who need medication and other necessities of life. Bakeries will function. Some of us need to go to a bank to get money, to go to the bank, to the supermarket. And so banks, they're very clear businesses that must function. We will allow that, but we have to restrict the movement of our people. We ask you to stay at home over the next 2 weeks. But if you must move for essential living, you would be allowed to do so. The environment now is different from how it was last year. And I pause now for a short break.
It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up. Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Just witnessed the handing over of a generous donation of 20,000 doses of the AstraZeneca Oxford vaccine.
It was a kind donation, as India understands that it is important for us to be able to ensure that the entire world is free of COVID-19, and the only way we can do that is through vaccination.
We welcome these additional doses because it would help us to provide a significant coverage, a greater percentage of our population in terms of vaccination against this virus.
And And just to note that St. Kitts and Nevis is also paying forward, and we are going to assist the government and people of Grenada by donating 2,000 of those 20,000 to the people of Grenada. And so once again, we just want to thank the government of India, and remember, don't wait, vaccinate. Today we're at the Newtown Health Center, where we've had the official launch of the COVID-19 vaccination program. We are so pleased to have had quite a cross-section of individuals who were represented here today and taking the vaccine. We had members of the cabinet, we had persons from the medical fraternity, doctors and nurses alike, and we've had quite a number of other persons from the clergy, from immigration, from police, you name it, they were all here to take their first dose of the AstraZeneca COVID-19 vaccine. And so we all got our COVID-19 vaccination card to indicate that we would have taken our first dose of the vaccine. Once we come back in 10 weeks, we will have our second dose, and then once we got that second dose, then the cards would be stamped at the front with the Ministry of Health stamp, and that is to finalize that you did receive both doses of the COVID-19 vaccine. A reminder that the vaccine helps us to ensure that persons do not have severe illness or death, and so we're encouraging persons to step forward and take the vaccine. Get all the facts that you need to get. The Ministry of Health provides all of the information. The facts on the vaccine are on the covid19.gov.kn website. And so we're asking you and urging each and everyone to come out and get your vaccine. Look at the information, get all the information that you need, whatever makes you comfortable. But I can assure you that we have all taken it so far, and I'm feeling good. My arm is good. It was a vaccine, and so I'm excited about that. And so I'm looking forward to my second dose to say I'm completely vaccinated for COVID-19. And as the science continues to evolve, I'm sure we'll find more information and more benefits as to why you should take the COVID-19 vaccine. But for now, I know that since I've been vaccinated, I lower the risk of me getting severe illness or death from COVID-19. I also know that I'm protecting myself, my family, and my community. So I'm asking everyone, get the facts and then get the vax. Today was an example that it is safe, and we urge each and everyone, when it's your turn and your stage come around, to get vaccinated. As we progress, we will provide more information as to the next stage and who will be next. And so look out for that information from the Ministry of Health. We'll keep you informed, we'll keep you updated, we'll let you know how many persons have been vaccinated, and we'll let you know when it's your turn that you can make your appointment calling 311 or any of the health centers. So go ahead, get your vaccination.
Hello and welcome back to our special discussion with the Attorney General, the Honorable Vincent Byron. We're going to be discussing the details of the recent announcement by the Prime Minister on the new increased measures to curb the spread of COVID-19 in the Federation. For those of you just joining us, last night, the Prime Minister made a national address announcing that over the next 2 weeks there will be increased measures to curb the spread of the virus. And we're here today to discuss some of the details of those measures and to address any questions. Now, as part of this, there will be an interactive component. Anyone within the sound of my voice can pose questions to the Attorney General by logging on to the ZIZ Facebook page or the ZIZ YouTube channel. Submit your questions below the live stream and I will receive them and pose them to the AG. So let's get right into it, Mr. AG. Now let's go back a little and address the first question that was on people's mind when they heard the address and the announcement of a lockdown. The last time we were in a lockdown was in early 2020, and that basically was a 24-hour curfew. Is this the same type of lockdown? Will there be a 24-hour curfew?
No, there's no 24-hour curfew. And with my introduction earlier, I tried to explain that last year there was a state of emergency. The borders were closed. No regular flights, airline flights came. People were asked to stay in their houses all the time until those were relaxed. The restrictions were gradually released. People could come out to go to the supermarket by zones, East Zone, West Zone. And we learned from those experiences how to gradually get us back to a sense of normalcy.
So,
Go ahead.
So to sum up, it's not a 24-hour lockdown. It's not the same situation as last year. Now, one of the measures was that the curfew hours have been extended to 6 p.m. So would it be safe to just call this another case of an extended curfew?
You can call it that, but a curfew is a lockdown.
Oh.
Think about it. You're not supposed to move during the curfew. It's a lockdown. So there is no confusion over that. Okay? During the curfew, you're locked down. It's as simple as that. There are different levels of a lockdown. You can have a, as you said, 24-hour lockdown, or you could have a partial program of a lockdown. I want to read for you something that I saw, because there's a lot of social media posts up and down. And this is a young man, I think he's based in North America, who wrote, "My best explanation is that it's a partial lockdown. You can go out between 5 a.m. to 6 p.m. only for essential things like food or medicine, etc. But you have to be off the streets between 6 p.m. and 5 a.m. It's very easy to understand. So it's a lockdown, partially. The curfew, you should not be on the streets between 6 p.m. and 5 a.m. Just to add, it does not mean, let's be very clear, that between 5 a.m. and 6 p.m. we could go to the bars, we could have fun, and we're up in everybody's face. Because the idea of this reset is that we try to restrict our movements so that you may have to go somewhere in the day, but it should be an essential move. I have to go to get vaccinated, those of us who have not. So you can go to the health center. I could be that I have symptoms. I have a headache, I have a cough. I need to go to a medical facility to get checked. So I can go to the health center. You have to move. It's essential. And so you do so. Otherwise than that, we appeal to our citizens. We ask them to stay at home. We have to interrupt the contact and the movement of people to break this virus. Okay. We have not gone to the nuclear to say no movement at all, because we want to be able to tell you that if you get vaccinated, enough of us are vaccinated, we should be able to do some movement. We should move, because we have to get back to normalcy. It's going to be with us for the next year, 2 years. Every time we have a spike, we can't have a complete 24-hour lockdown. It's very, very important. So we are learning new ways to behave, new ways to live. And we know our people are intelligent, that they're resilient, and they will adapt.
Okay, so another element of the speech that raised some questions was the mention that essential businesses will be open. Now, I know under the previous full 24-hour lockdown, when it began easing, and the SRNOs noted that essential businesses included pharmacies, hospitals, and I think gas stations and financial institutions. Bluntly put, what are the essential businesses that were referenced in the speech?
Well, the Prime Minister gave an overview, and the details will be established by the statutory rules and orders that will be promulgated and spread today. But I don't think there's any rocket science behind that. You have listed the essential services.
If I may interject right here, one of the questions I've been getting repeatedly regarding the essential businesses, will supermarkets be open? Because people need food.
But that's clearly it. It's an essential service. So supermarkets will be opened. They have already adjusted their hours with the current curfew that is there. And we restrict the curfew, we extend it to 6 p.m. and they will readjust. But they will not have just a limited window. The idea being that we don't want to create a further problem of people rushing the supermarkets. Because then we have mass gatherings and we have the potential for spread in that environment. So we say that you should have enough time to go to the supermarket and shop, get what you want, your essential stuff, and go back home.
Okay.
So that is an essential service.
Okay. Now, again, in the speech, there was let me back up. We already have the established concept of what an essential business is supposed to be, the essentials. However, in the PM speech, he also mentioned that restaurants will be open. Granted, it's only for takeout and delivery, no in-service dining. So the question again was raised, are restaurants an essential business now as well, since they have to be open in order to provide takeout and delivery?
Well, we have to use our common sense. And we talk about food. Some people don't cook. Some people go to a eat out every day. So what, do we close them down? And so some people will be excluded? So we say yes. A restaurant can open, but you can't go and sit down and line and talk. You go, you order, and you take away. I think a common sense approach to this as we develop that sense of normalcy as we go forward, because we have to interrupt the virus as it is in St. Kitts and Nevis today. Right now, people are moving. And I know you have a number of questions, but don't mind me if I expand to that to go on. One of the issues that we have has to do with street vending. And all of us know, sometimes it can be a nuisance, but it does serve a purpose. So that I have a tray, I don't take any temperature, I don't record who comes to my tray. I sit down by the tray and I talk, and people come there. But imagine that one vendor may have, God forbid, symptoms of COVID. They can become a super spreader. And we can't trace any of those people. They don't know who come by their tray. And that is something that potentially of creating the spread of the virus in our community. So we say for the next 2 weeks, as we try to get this under control, that the vendor should not be on the street. Okay. And that eliminates that problem. But at the same time, we say, if the vendor who serves a purpose, whether it is vegetables, various types of food items, can function in a controlled environment.
Such as the market.
Such as the market. If you go to the market, you have to pass through a gate. And somebody will be there to know who is coming, check your temperature. And so that then allows you to control that, and that vendor who serves a certain clientele, they have their customers, can still function. Okay?
Okay, so...
Because, and let's be clear, we have a situation in our country where this is not just for the big supermarkets to continue to provide services, but continue to make money. But the little man has to continue to make money too, to live. And it is that we are considering all of our society to ensure that most of our society can be supported as we move forward. We are getting that time of normalcy. How do we live with the COVID? How do we live with the pandemic? And we hope that in this controlled environment in the markets, that the small tray person can carry their customers with them And we have that.
Okay, so just to sum up, regarding the topics I just raised, essential businesses are defined as the list that was previously used, the essential needs, as it were, food,
right.
medication, and supermarkets are on that list.
That's correct.
However, the full list of all businesses, the essential businesses, will be detailed in the SRNO.
Well, I don't think that you can go that way, because then we'll be having oodles of it. There are over 800-900 businesses in our country. And for instance, the chamber is 100 and something businesses. And I think that there's a level of detail that we don't need to do. People need to use their common sense. And because it's pretty straightforward. There are some businesses that clearly we need. I have to go to the hospital. I have to go to the health center. I have to go to the pharmacy. I need money to do it, to the bank. A gas station, okay? Because there will be some movement, but it's limited, restricted movement. Okay?
I understand it, but the question is being raised outside of those obvious essential businesses that you've just raised. There are places such as hardware stores that persons might need to go to make repairs.
Yes.
There, someone might need to go to, let's say, a department store to pick up non-food items.
That's essential?
It might be. They might have a need at the moment. You see, I guess it all comes down to how do you define essential, as it were.
Jason, sorry to interrupt you, but we had this last year. It worked last year. The question we had was worked last year. I have plumbing to do at home. My pipe bursts. How do I get something to repair, to fix that? And a special dispensation was given to certain hardwares to solve that problem. In the regulations last year, and they're recaptured here, the Commissioner of Police can give permission to certain businesses that approach him, that show why there is a need. And so he has the authority to exercise exemptions accordingly. But the question is, we don't want to be, oh, this one is on the list, this business and that. We understand what it is, and we have been there before. We are trying to let people live, continue to live, but we have a problem. And the problem is that right now, there's a spread of the virus in our community. We think that if everybody gets vaccinated, it will not be a problem, because it lowers the risk of spread. So for instance, an essential service that cannot be that we can't stop is for people to go to the health center to get vaccinated. And that will be every day. Today, right now as I speak, people need, those who are not vaccinated, to go to the health center to get vaccinated. Because that will be open today. And it will be open on Monday. And every day that the health centers are open, vaccines will be given. Because if we get to that point where most of our people are vaccinated, we won't have to be going through this.
All right.
So vaccination becomes important, but until we get to that point, we have to do certain restrictions, because there's a spread in the community, and if people have to start to go to the hospital, then our health services become overwhelmed. We won't be able to cope with it, and that's when we will have a real crisis on our hands. At the moment, it's managing that situation.
Okay, so from what you've just said, can I glean that there is no list per se of every single business that will be
Clearly
open?
not.
Okay, so from an employee standpoint, if person X works at establishment A, how would that employee determine if he or she is to go out to work?
Well, they call the employer, and the employer would know whether they will be open or not. If the employer is given a service that is critical and understanding, then, and they can't work from home or remotely, because there are a lot of businesses that can do that, you will apply to the Commissioner of Police, and he'll evaluate it and give permission or not. It's not that I'm going, or when I say the government will sit down and go through every business and determine, give that one and that. It's not a discretionary thing. The Commissioner of Police has that discretion only. And so he'll be the one to determine in this current 2-week window. At the end of 2 weeks, we evaluate it. Have we gotten, numbers are down, we have a control on it? Both. We go back to less restrictions and so on.
So bottom line, if you want to know, you're supposed to go to work,
you call your
employer and he or she will tell you.
They'll be able to tell you.
Okay, fine. And I shall hope that the employer is informed enough to be able to give an answer.
Well, the employer should know if they fit into that category, and the way to do it is, if you're not clearly establishment, you call the Commissioner of Police. You go to the police hotline, you make an application. Let me give you an example. I work in a bakery. I call it my bakery, but the bakeries, we say, in the regulations, are essential. So many of our people wake up in the morning and they want a piece of bread. So we have to produce bread. The employees of those bakeries are clearly exempt. Let me speak to it, because we have to do a balance. There is a balance involved in all of this. And in the last year and months, we have tried to be as thoughtful as we have. In the fight for COVID, for instance, we established a national COVID task force. And that national COVID task force had senior representatives of most or all of the government ministries. We had the Commissioner of Police, we have permanent secretaries in tourism, foreign affairs, the commander of the Defense Force, and I can go on and on, but very critical in it were representatives of the Ministry of Health. The task force and those experiences have been able to help us over the last year, that we have become complacent because things have been managed very well. One of the things that we are particularly proud of is that at the end of October, November last year, we opened the borders. And when we opened those borders, we allowed planes to come. How do we manage our locals, our nationals to return? How do we get guests to come so that hotels can open up and people can get employment? Because people have to live. And we developed what we term as a corridor of containment. At the airport, you go to a quarantine site, hotel site. So to get there, you have to drive there. And so we have a whole cadre of certified, COVID-certified taxi operators. They're efficient. They know their work. They have protected themselves. They wear masks, they sanitize, they have plexiglass between them and their passengers. They are experienced, efficient people. So they will work, because the planes will come. Nationals coming back to go to COVID, to quarantine, the visitors, and those taxi drivers will take them there.
Okay.
They are not restricted. It's important for me to explain this. I know you have your questions. It's important for me to explain that. When they go to the quarantine site, the hotel site, they have to cater to these people. And it is workers who cater for these people. It's different from last year, the total lockdown. So there is restriction, a lockdown, but there will be some areas where we have now to learn, to adapt, to provide for normal life. And this quarantine site, hotel site, has to be manned by our citizens, our workers. So if I work in hospitality, I work at Marriott, I call up my supervisor, and they're open. Let me give you further. How do I get to work? So I have to take a bus to get to work.
If I may interject,
Yes.
someone actually did ask me about the bus, if there's any changes to the bus service.
Again, it has to do with common sense. I myself have to know that I have to get to work. It's an essential service, and you should have a pass from your employer. That's what we did last year. We're not reinventing the wheel. The people who had to go out in certain circumstances got a pass from their employer. They contacted the police commissioner, and they were issued.
Well, sorry, sorry.
Yes,
I
I'm
think you might have. I think you might have misunderstood my question.
sorry.
Yeah, my question was about the bus services. Will there be any changes to the service being offered by passenger buses, or will they be running as normal?
Well, Jason, I'm saying that you have to use common sense to this whole issue. I would think that buses will provide services for people to move, because some will have to move. We want to get back to normal living. We want to get back to normal living. We have been doing it. But we have had a spike, and we will have other spikes. Let's be clear. This is not just a one-time thing. When we control this, it may happen again and again. And we don't then have to go into panic mode every time. So we are gradually learning behaviors, and we're getting regulations to help us to adapt to that. So I make the point again. It doesn't mean that everybody's going to be on the bus every day you normally are. There will be reduced numbers, which is what we want. Significantly reduced, because the average person say, boy, I don't have to go into work, let me stay home. Some people say, well, I'm going out, I'm going by a friend. But you're putting yourself in danger, because your friend may have COVID. Okay? So we're trying to restrict you, but you may have to go. I'm sorry.
So, yes. So one of the questions that's come repeatedly, by the way, I am receiving the questions from the citizens from on our Facebook and YouTube pages.
Yes.
Please join the stream and preface your question with the word question, so that we can easily identify them and I can pose them to the AG. One question that's been raised repeatedly: what about the churches? Will churches be allowed to function in this 2-week period?
It's a very important question. The churches have been one of our stakeholders that have been very, very important and given tremendous support to the whole program. Earlier o'clock in our discussions, the churches took the position that they'd operate virtually. So they were still having services, and it developed as it was, a whole religious thing virtually. We would like them to return to that again for the next 2 weeks, because there are people in our community who could have gone to a trek, who could have been on a bus and have COVID, may not know it, and go to church with other parishioners, with other congregationalists, and say, people themselves have to be careful about going to church. And I will tell you, there are some churches who are already taken that position. So we know, we had been, I must confess that this has happened over the last 24 hours, and we have not had time to have had the discussion, but we intend to, maybe today, shortly, to have it with all the stakeholders who we have worked with over the year. The Evangelical Association, the Christian Council, have been solid in their support for our fight against COVID, and they understand it. But we would hope that they understand for the next 2 weeks, initially. We will have to restrict them and hope they can do so virtually.
So, simply put, is that a yes or a no? Will churches be functioning? Or?
I'm asking you to understand again. Is it black or white? I would say that the churches should operate virtually. Okay?
But that's a suggestion, not a mandate.
It's a mandate.
Okay.
It will be a mandate. You see, you want mandates. Well, it's a mandate.
Okay. I mean, I think what people want are clarity, not things that are prefaced with "I would hope" or "it would seem." People at this point want clarity so they can know how to govern themselves.
Yes.
Because two persons' take on a suggestion might be completely different. So, bottom line is, churches will operate virtually.
Will operate virtually.
All right. That's.
I will say, and let me make the point, because even when you operate virtually, there are certain services that a church does that are critical to our life as a community. Funerals, for instance. And what we will do, we'll restrict the numbers. If there has to be a funeral over the next 2 weeks, we'll restrict the numbers at attendance. Those numbers, maybe about 10, 15 people would attend a funeral, a wedding, if they still have to have them. Because we want to restrict the interaction, the gatherings, to be able to get a hold of this virus.
A question that has been asked, and I think this needs to be put forward. Now, as you stated before, persons are being encouraged to only leave their homes for the essentials, as you mentioned, food, medication, and whatnot, would there be some sort of management? Will the police be stopping persons and asking where you're going to determine that you are actually doing essential business?
Well, that is the Commissioner of Police and his team are meeting, and they will know how to manage it. They managed it last year, and we had that. I suspect that yes, they should. But we say that you can go to a beach for exercise. We say that you can walk out from your home. So we live in a society, a democratic society, that we hope our citizens will understand their civic obligations, that they will do what they understand to be right. And I go back to the basic premise of all of this. There is the spread of a virus in our community, and we want to interrupt it. Citizens going and mixing in the other world have the potential of spreading it.
Okay.
We say you should stay home. But there are instances when you have to leave. I get up at 5 o'clock, 6 o'clock in the morning after the curfew hours. I can go for a walk to get exercise. But I should go back home.
If I may jump in, that's exactly what was going to be my next question. You mentioned the beach for exercise, and but that was the only specific example of exercise that was given in the speech. So people were asking about jogging, walking, running. They're not going for, and it's to an essential business, as it were. So will they be stopped on the road?
They would not be stopped.
Okay. So your morning walks, your morning jogs are perfectly fine, as you've been doing.
But you're not doing it with a group of 10.
Right.
A group of 8. You want to reduce that interaction. And you as an individual must be intelligent to know that I don't do that. Should the government come and tell you every aspect of it, there are very clear guidelines, and we need you to behave in a certain way. The principle of the behavior is what I'm emphasizing.
Okay. I think that people were just, trying to be clear, especially since because only certain specifics were given in the address. So they wanted to know if other specifics, which may fall under the overviews that were listed, are clarified. If I may go on.
If I can respond to that. There will be published today. There is, as I speak, an SRNO that will cover the specifics. And there will be a briefing at the National Emergency Operating Center at 5 o'clock this afternoon, where this would be the specifics in the law will be detailed to the public. It will be circulated hopefully before that, but so people can respond to it. But this has been the practice over the last year, where we had different individuals who have come forward. Superintendent Carmen Henry has been excellent at explaining what these restrictions are and what the law is. So we'll have that this afternoon for those who may not quite understand by then, to be able to get further explanation.
Okay. Now, you already mentioned that church services must be virtual. Now, what about events that are usually church-related but are not the standard Sunday service? I speak specifically to weddings and funerals.
I mentioned them.
Okay. Could you just repeat for persons who may just be tuning in?
I mentioned them, and I think basically you're saying that those have to be restricted. If you have to have, during this next 2-week period, that these will be restricted to 10, 15, whatever it is, but you want to restrict. I keep coming back to the same principle, Jason. And I think that everyone should understand that we want to keep numbers down or non-existent so that we can interrupt the spread.
Okay. You've already mentioned that incoming flights are still allowed.
Yes.
And so therefore airport workers would be allowed to go about their normal duties. Yes.
Go.
All right. What about ocean and air shipments and brokers who work in small courier service? Will they be allowed to offer services and deliver items?
Well, again, it comes back to the business, the nature of the business, and it comes back to the nature of the service that they're offering. If, for instance, I've gotten something that is urgent, food or something, clearly those would have to function. Those would have to function. Because, again, we want to have this thing interrupted but we are not looking to promote people to doing stuff. But I think that is something, if they are not on a list, if they're not they call up the commissioner. And the commissioner will grant permission to those individuals to do that type of work.
Okay.
So this would fall into those businesses where the commissioner has the latitude to grant a permit to be able to have services of that nature.
Okay. I continue with the questions that are still coming in.
Yes.
What about the construction industry? The
construction will be suspended for 2 weeks.
Okay, so construction is suspended.
Yes. I would say that that is one that, again, would have some exceptions. I have a burst pipe in my house. I need a workman to come and fix it. And that is an essential service. So that person should be given a permit to come, or should be allowed to come to fix that. I have a door, some emergency function, but the general construction business will be suspended over the next 2 weeks.
Let me continue. I have quite the list here. Now, you already mentioned hotels will not be closed.
Again, I'll go back and repeat the principle, because it's important to understand. There are hotels that are quarantine sites. They must function. They must be open. And the people who work for them have to go to work. Okay? So that is, I think, is pretty straightforward. A plane comes in. Once somebody lands in St. Kitts and Nevis today, that plane, the load, has to go into quarantine. And the quarantines are at very clearly defined hotel sites.
All right.
So the hotel workers for those sites must
turn up to work.
Must turn up to work.
All right. This is June, normally an exam month.
Yes.
What's going to be happening with the CXC and CAPE exams?
But I think that was also clearly established by the Minister of Education a couple of weeks ago, that those school has been suspended or closed until September, and that there are various platforms in which people will do their schoolwork at home, those that have. Again, we would have to hear from the Ministry of Education exactly what is the arrangements for CAPE and for CSEC subjects and that type of stuff. At this point in time, I cannot speak to that, but no announcement will come from the Ministry of Education, from the Minister and his team will understand what to do. But that is a critical function in our society, and so if exemptions have to be given, they will be given. Again, the principle, we want to reduce movement, people stay at home, but if you have to move, you then will be allowed to move.
Okay, I missed this follow-up to the question about reporting to work. You've already stated that the best way for a person to know if they're to go to work at a business, call your employer and he or she will tell you. Is there, for the government institutions, civil service, is there a blanket rule or is it a case-by-case basis? How does that work out?
Well, in the government rule, we have said it's the same principle we did last year, that all government employees should work from home unless their agency, their business, whatever it is, has been granted leave by the cabinet secretary. Now, she's not going to go to everybody, but basically what it would be, let me give an example of the Attorney General's chambers. We have had an exemption in the rule, but for some time now, we have arranged for our staff to work by rotation. Some work from home, some work from office. They still do their work. And there is interaction. We work virtually because we put a lot of our work online up in the cloud, and so we work. It has not in any way diminished the ability for us to work. And there are many businesses who have already done that. The coming to work has to do with an in-person contact. And there are some offices that must function by in-person. Now, if it is essential, you have to continue to do so. If it's not, we say stay home.
All right, and of course the essential services for civil would be police,
that's right,
medical, fire,
yes,
etc., etc. Okay, here's some if the 2-week curfew does not bear fruit and the numbers increase, what happens next?
Well, that is a matter for discussion, for advice by our medical fraternity. the chief medical officer, the medical chief of staff, they have given us done human service in our country, and we believe they've given us great advice. We are still one of the leading countries in managing this COVID over the last year and a quarter, and so we believe that we would hear their advice and adhere it. I cannot at this point in time determine how cabinet will respond to that advice.
Okay. The questions keep coming in, so I'm just trying to make sure
Yes.
I don't miss any of them. You mentioned persons can exercise in the morning for your morning walk. Someone has asked, would athletes be able to continue their training at the stadium in Bird Rock?
Well, again, it's an open question. I would tend to think that athletes can do so individually. But why do they have to go to, if maybe at Bird Rock, I don't know. But the idea, the same principle, if you're running with 5, 10 people, we discourage it. And your coaches and those in charge of your team should discourage that. But we will hope that for the next 2 weeks, you can reduce that contact and stay home.
Okay.
It's a balance, Jason, and I want our people to understand that. We have worked very hard last year to get us to a point where we gradually get to what we call a new normal. And we are trying to find that balance. We do not want to close you down and restrict you totally, but we still have to function. This year is a reset to allow us to organize ourselves, to be aware, to become very serious about how we live as we move forward. And there will be some adaptation. We have to adapt and so forth. You have not asked a question on this, and I want to speak to this because it's an important idea. One of the communications that we have had comes from a very thoughtful lady, a lawyer lady, who is speaking to the fact that some businesses have been able to get their employees to vaccinate. We encourage people to vaccinate because we say that this is the ultimate protection. And one of the considerations that we in government have to determine is whether there will be some relaxation for those who have gone out and done the necessary to protect their employees.
So
what happens to those who are unvaccinated? That is a consideration that we are discussing. There is no determination, but we encourage people to vaccinate because there could be certain adjustments to those institutions, those businesses who have done so. In other words, I have a business fully vaccinated, I can function. Those who are not vaccinated have the potential to spread the virus more. And so we have to consider whether there will be a special carve-out for that situation.
If I may jump in right here, it's as if you're looking at my questions because someone just asked me, they posed the situation, they work in a law office, everyone is vaccinated, so can they operate normally? Short answer.
At this point in time, I would say no, because we have not made that consideration. If it does essential work, because in a law office, a lot of what you do, you can function from home, okay? But there may need to be in-person work, in which case a special case can be made to the Commissioner of Police.
All righty. Well, this is, I know that you mentioned the bus services are running normally. Are they allowed to take people to the supermarkets, etc.?
I'm sorry, I missed that one.
The question is, are buses, public transportation allowed to take persons to the supermarket, etc.?
Well, again, the general principle, that would come from the police and the security forces. And I would say that that one would have to hear from the police on that one. Because
Okay.
it has to do with how they manage these questions. As far as I know, buses should go to the bus route, and you should go to the bus terminal. I'm not certain about buses going off the route, because that sounds to me, unless there's a bus route to a supermarket, I don't know.
Okay. Someone posed the question. The majority of the cases have been in St. Kitts so far, the vast percentage. And they were wondering if the new restrictive measures couldn't have been posed to St. Kitts while keeping Nevis on the earlier restrictions.
I think that is a no-no at this point in time. It's one country. It's like saying maybe Sandy Point doesn't have any cases. Should we allow them to function differently, say from Bastia? Or Charlestown and Gingerland have two different sets. I think that at this time we have to maintain the integrity of the state, and we believe that once we do this, we're in this thing together. You know what I mean? And so I do not believe, I cannot speak ultimately to how Cabinet will make such a determination. And up to this point, I think it's something that we have to be very careful about and ensure that the guidelines cover the entire country.
As persons are being encouraged to go out and get vaccinated, will there be a restriction at the clinics for the amount of persons who can be attended to?
Well, that has worked well up to now. I think that when you go to the clinics, there should be social distancing. We speak about that all the time. The normal protocols should be in attendance. You should wear your mask. You should sanitize. And the numbers that way should be able to be controlled. We encourage people to go to the health centers, and we have seen lines going out into the streets, unfortunately. But people have been coming, they want to get vaccinated, they know the importance of it, and we should say that if you have to wait, you wait, you don't walk away. I know I remember going to Newtown Health Center and seeing a tent in the air, and the chairs are properly spaced, so it should not be an issue.
Okay.
Everyone who wants to get vaccinated will be accommodated, and we urge them to come. It'll be a good problem to have where you have too many, but we urge you to come and get vaccinated.
There's also the question of groomers, hairdressers, barbers. Will they
Those will be closed.
Okay.
Clearly, that is not essential at this point in time, and we want to ensure that that's one area where you don't have that close proximity and the potential for transmission of the disease.
Another person specifically asked about about mechanics. Mechanic shops, are they open?
Well, again, the same issues, Jason. Emergency, essential. I would tend to think if there are vehicles that are breaking down and are essential, you may definitely need to have some urgency. But if you're home, that should reduce the need for that type of work.
Well, I think the question came from the from the standpoint of the mechanics themselves. Do they open?
Well, I don't know how all of them work. Some of them are the work where people call them, and they can go to somebody else. But if there is an emergency, an essential issue, I would tend to think they have to function. But they're not clearly set up on the list. Again, the principles operate. Somebody needs a mechanic, I need to function. You should have the number for the police commissioner, the police website, and you make an application and explain to them why it is you have to function.
Okay. So it's up to the mechanic to, pardon me, to reach out to the commissioner
Yes.
and make provision or state their case
State their case.
to be open.
That's a good way to put it.
Okay, fine. Let us keep, the questions keep coming in. Will flow, courts, etc. be open so that you can pay your bills? Paying bills is essential. Paying bills is essential.
Well, again, we had that problem last year. What happened last year? People didn't pay their bills. People found ways to pay, and you found that those establishments found ways for people to pay them online and other sorts of ways. It's for 2 weeks, but it's not a difficult problem. I would tend to think that arrangements can be made for people to pay their bills without it being a free-for-all. We want to reduce the in-person businesses that do not have, at this point in time, to be in person. Because we have found that where we have had those type of businesses, a number of the cases have been coming from that environment. That is why businesses is one of the problem areas that the health team has indicated to us that they'd like to stop, but we can't stop all of them because some of them have a very critical and essential function to do. And so if you feel that your business is critical in function, you make representation to be able to see that. And you can get, if it's thought to be so, a special dispensation to run your business. Otherwise, for 2 weeks, we ask you to suspend your work if you cannot do it from home.
So I'm just filtering through the questions that are coming fast and furious. Let's see. 1 second. Just a reminder that you can pose your questions to the ZIZ Facebook and YouTube channel. Follow the live stream and please introduce your question with the word question so it'll be easier for us to sort through the responses and get to the actual queries. Okay, let us go back. You mentioned that, I remember in the Prime Minister's address, there was a mention of stricter restrictions on the ferry. Can you go into a bit more detail of what will be in place for persons using the ferry?
At this point in time, I would want to defer on that one because it gathers the same issues that we're talking about, that if there are essential movements, that between St. Kitts and Nevis, there is one, for instance, that has been, I know, is of concern. There are some people in Nevis, for instance, who take dialysis in St. Kitts on a daily basis. Should we deny them? They have to take dialysis. Do they do that by general ferry or whatever it is? There's certain essential questions that have to be dealt with that we have to be very careful because we want to get to that new position of normalcy. And you don't want to put people in jeopardy if we are rigid on some of these questions. But in terms of normal movement back and forth, people should be at home unless they have essential work to do. So we'll see to that one.
Okay. Here is another question coming. As a private healthcare practitioner, do I have to get a pass from the Commissioner of Police?
I would say that's a good idea. I think you should let the Commissioner know. If I'm a doctor, those are clearly an area that should be open. People should have to go to be able to go to their doctor. We need doctors to function, to check on their patients, to ensure that, God forbid, that they may have COVID or whatever else. So I would say that they are clearly part of the essential services that we have to allow.
Okay, and just to repeat, because this question came back up, food vendors are allowed to open as long as it's takeout and delivery?
That's correct.
Okay. Going back to... Someone was asking about the rationale. Why aren't gyms considered essential because fitness is health?
Because you come into close contact with other people. You're in the same limited space. You're breathing and your globules are good. And so it's an area where we can transmit from one to another. I would tend to think it's very difficult if I am doing on a treadmill and a jogging. The breathing becomes problematic if you're wearing a mask or whatever it is. Again, we have to be thoughtful and just think it through. But I would tend to think gyms can be considered an area where you can spread the virus, and they would have to stop and cease.
What is the government hoping to accomplish during the next 2 weeks, and what would be the next step?
Again, we want to reduce the movement of people. It's a restriction on movement. Because once you move, you can spread the virus. And so the accomplishment basically is to allow the transmission to stop. Ideally, you want a total stop, but people have to live, and people have to have certain services that are done. So it can't be 100% stop. The question is a balance of how much we can relax that complete stop. If the virus does not mix, if me and you are not here, we can't transmit it to each other. That's a stop. And so the next question would be, it allows the health teams to see if people come forward with symptoms, to treat them, to interrupt that spread. Now 2 weeks, we have told scientifically, is the period of incubation of the virus. And so if there's no movement for 2 weeks, by the end of the 2-week period, it should have incubated and we should be in a position where we reset and then we can move again. Now, exactly what would be the advice of our health professionals if 2 weeks from now we're getting the same numbers that we are getting now? It's unlikely that we'll get those same numbers from a layman's perspective. But we'll have to rely on their advice at that point in time, going forward. Let me make the other point that I've said at the beginning. This is something we're going to live with for the next few years, next year, 2 years. And so there may well be another outbreak in 3, 4, 5 weeks because the airport is open. Planes are coming. And as strict as our restrictions are about people coming, you can't come if you don't have a PCR, RT-PCR test, taken 3 days before you get on the plane.
And are fully vaccinated.
We have to be fully vaccinated. But we have said that our citizens can return if they're not fully vaccinated. So there's still the potential for it to come in through our borders. So we can have other outbreaks. But we say that if our citizens significantly improve the numbers who are vaccinated, that there is a much lower risk for there to be another outbreak. There's a much lower risk for it to be transmitted. And there will come a time when we will not be talking about lockdown, curfew, because then instead of 11, I think the figure that the Prime Minister mentioned last night was 25 cases on Thursday.
On Thursday, yes.
So that we may get 1 case, a 2 case, but that can be managed by a health system and it would not be alarming. Okay? We work in an office or in a business, somebody has a cold. Somebody might have a flu in the office, but the business does not go under. But if everybody's sick in there and like a fever going around, it may be best for this to close. We need to get a handle on this. And we believe, from the advice of our health professionals, that this is the right thing to do at this time.
Okay. Will there be any financial relief for non-essential persons who lose income due to the lockdown?
Well, that is something for Cabinet. That is something for, and I think that the Prime Minister is also the Minister of Finance, will be bringing that to Cabinet, whether as a government program working, say, with Social Security, who is supposed to be able to assist us in these matters. But I can't speak to that at this time.
Okay. We have just 15 minutes left in the program, so I want to get through as many of these questions as possible. The question has come up a couple of times. A cruise ship is scheduled to arrive shortly. Will it still be allowed to dock? How will we be operating? What's going to be happening with that?
A very good question, and I believe that a decision has to be made sometime today or tomorrow. There have been discussions between the Ministry of Tourism and the task force and the Ministry of Health. There have been walkthroughs at Port Zante. They have been looking at it. But there are a number of issues, and especially at this time, in terms of this critical outbreak, that has to be a consideration. And I would tend to think that we would rely on a decision of the cabinet, having listened to the Ministry of Health, medical experts, as well as the tourism question. But an announcement that will be made shortly, and I would not be in a position right now to say exactly what that decision is.
All righty. Another question. Can business persons attend their business places for office hours without opening their businesses?
That's a very good question. Again, I would say that it sounds very much doable, but we want to stop people from traveling, to stay at home. If it is that you can work in your business without opening the doors, can you do that same work from your home or in your house? You know what I mean? We'd hope that there is some quiet spot in your house that you can do that. Because the objective, as the earlier question was, is to stop movement, to restrict movement. And once we move and be out there, sure, we want to restrict interaction. So in-person communications is one way in which you want to restrain that. But clearly, it is preferable if people would stay at home, shelter in place.
What is the procedure for persons from overseas travelers who are vacationing in place? Are they tested upon arrival?
That's a good question. The practice, as I understand it, has been that you have to be tested before you come. You have to upload those tests to show you have had it from a reputable lab or agency. You have to upload your vaccination record to show that you have been properly vaccinated. These are criteria that once you land at the airport are assessed by our health team at the airport, who have done an excellent job. And there are some instances where people have had to be tested. But it is not a standard procedure, as far as I understand, that everyone is tested on arrival. You have to be tested when you go into quarantine to be released. You have to have a negative test to be released into the community. And that is normally after 14 days.
There's a follow-up to that. The concern was that since, as you mentioned, there doesn't seem to be a test immediately upon arrival, there's a concern that some of the vacationers are moving about the property and interacting with persons who may have already tested negative.
I think these are questions that I believe would be much better directed to the Chief Medical Officer and the health team. They have studied the thing over and over and over. And they have made these recommendations. And we are comfortable with the advice they have given us. The vacation in place has been something that has been going on for months. And we can say, as far as I know, the evidence is that it has not failed us at this point. So that it is something that's worked for the most part. I believe everything. So there's no evidence that there's any weakness or lacuna, any gap in this particular practice.
Another question that's just come in, can a parent or student go to their respective school to submit their work?
Again, I would prefer not. I would tend to say that there is no urgency in that, as far as I understand, and we would prefer that that not happen, that the parent communicates with the teacher and the school, because again, the principle is, unless you essentially the emergency that you have to move, we hope that you settle.
Okay. Will a team be put in place to check on the elderly and needy people in the community during this lockdown?
A good question. I would say that at the task force, there has been a lot of work done. Even without this, the task force prepares dozens, scores of lunches daily. And they have people working to go and feed people. We understand in a lockdown, in a situation like this, others may need to be added to the list, but there are a lot of work. I should preface it by saying that there is an agency of government at the community services, social services, headed by Permanent Secretary General Lewis. There's Mrs. Wigley, who they do an excellent job. There are databases they have of the elderly and those who are normally difficult to operate with, and they are very closely aligned with them. So there is a government network, a net that deals with it. There might be one or two people outside of the net. We'd want them to register, to be known, and anyone who knows of anyone who needs that type of assistance should communicate either with the Department of Social Services, or the task force is also set up to respond to that type of request as well.
Alrighty, I'm just still sifting through these. I think we answered this earlier, but this is a bit broader. Will couriers such as the post office and FedEx, etc., be open?
I would say that there are certain, we found last year that they were important. People send material, various things, to relatives all the time. Some of that could be urgent and of emergency in nature. And FedEx and the various couriers did function under the lockdown last year. So although we did not allow American to come, there were courier services that functioned under, quote unquote, the much stricter lockdown that people would have realized last year. And we did not find it to be a detriment. So that is something that I would think would function still and should not be interrupted.
Okay. Will Inland Revenue waive its late penalty given these new restrictions and the loss of income for some persons?
I can't speak to that.
No.
I would say that it is a very reasonable question that will be looked at the Inland Revenue Department, and the government will make an announcement of that subsequently early next week.
Alrighty, we are almost out of time. I just want to make sure I do not miss any of the questions that have been posed, because there are lots and lots. But if I just were to just summarize, so the crux of the matter is, first of all, it's not a 24-hour lockdown.
It's not a 24-hour lockdown.
It's more or less an extended curfew with how businesses are, with more restrictions on the businesses.
I'll answer you this way. I think we are spending too much time on the meaning of the word. I spent a lot of time, I'm prefacing every question with the general principle. Okay? A curfew is a lockdown. Let's be very clear. So that those who are looking at the semantics and say, oh, it's not this, I'm disappointed, and all of that. It's very clear. From 6 p.m. to 5 a.m., you ain't supposed to move from your home. Unless you're working for Skellig, and somebody electricity gone, or the power station, you're supposed to be home. So consider it a strict lockdown when it comes to curfew.
Okay.
From 6 p.m. to 5 a.m. Very simple principle. 5 a.m. come in the morning to 6 p.m. in the afternoon. There are limited situations where you should leave home. You ain't supposed to go line by a bar. That's a no-no, and drink rum or beers. But the lime in. I can go by your friend and stop off. You want to carry your COVID to the friend, or your friend give you? We are saying that, restrict that. Slide down. But I might need to pick up something at the supermarket. You can't go to the supermarket. I have some symptoms. I couldn't go to a medical facility. They're the things, and I think that as our people understand and adapt to this way of life, it helps us to reset. Because last year with the strict lockdown, people felt a certain way and we lived. We released and we relaxed some of those restrictions, and then people started to say, no COVID here. So I could do whatever I want to do. And we went to the other extreme. We are hoping that with these new restrictions, that we can become more responsible again and understand how we function.
Okay.
I hope this has been helpful.
Well,
and to people want exact answers for everyone, but it's the nature of life. How people live, everybody doesn't live the same way, and we don't want to have everybody regimented. But clearly in a democratic society, there comes a time when you have to put certain restrictions in place for the benefit and good of the society.
okay. Just could you repeat once more? Can you give people a summation of what can and cannot be done during the daytime hours after the curfew has passed? In other words, between 5 a.m. and 6 p.m.
I thought I'd just done. But again, I will go again. I think O.B. Eliot, that's who did put up that post I read earlier, said it best. From 6 p.m. to 5 a.m., you ain't supposed to move. From 5 a.m. to 6 p.m., if you have to come out from your home for some sort of essential business, you're allowed to come out. So if I need to go to a supermarket, I can go to the supermarket. We feel that you go to the supermarket, you should prepare yourself before, get a list. Then you go back home. I may need to go to a doctor because I have symptoms. You can go to the doctor. He might give you a prescription. So I can go to a pharmacy or the health center. Most importantly, I think I keep urging it, that we should go to the health center if you're not vaccinated, to get vaccinated. Because the more and more of us get vaccinated, the less chance of us having what we're going through now. We will reach a point where we don't need to consider emergency regulations or regulations of this nature, because we feel enough of us are not sick, so that if one or two do get sick, it will not flare up and be a problem. That is really the principle that our health team, the Ministry of Health, has been insisting on for this year. We urge, we encourage, we appeal to our citizens to do so, because then we will not have these types of restrictions that can be inconvenient. But it's important for us to ensure that we cover these things. There are other services. I want to say that because we will hear about this, and I want to be very clear on this. The idea is that we are trying to get to this new normal. We are in a new normal, normalcy. And so we have had you stand up and take notice this week, or last night, the Prime Minister. And we are then adapting to this new normal. Because there's something that we want to happen in our society. And I was at pains to mention that the borders are open. They're happening today. People will land and people will leave. And people must work there. If you land by plane in St. Kitts and Nevis, you have to go to quarantine. You go to a quarantine site. And for the most part, we have had hotels as quarantine sites. For the hotel to function, you have to have people work there. So there is not just a strict lockdown. We are getting to that new normal where we learn to live. And over the last 6-7 months, we developed a corridor of containment. People were trained and equipped. Taxi drivers wear the mask. They got plexiglass. There's back and forth in their meetings. Some were a little reluctant, but all of them now understand it. And so we did well that way. So there is that bubble, and we'll develop other sectors where we can get to that point. But for the most part, what we are saying is that we want to get to that new point where we can live and we don't have to consider closing down. We don't have to consider lockdown or even curfews, because enough of us are vaccinated. Vaccinate, vaccinate, vaccinate. and that helps us to solve this problem once and for all.
All right. Well, thank you very much for your time. We're going to be wrapping up now, but just to, if I can just summarize the main points. One, it's not a 24-hour lockdown.
No.
Two, there is a 6 p.m. to 5 a.m. curfew where you should be staying at home.
That's right.
Outside of those hours, if you must leave your house, it should be for essential purposes. Many businesses will be open, particularly those that are essential, the daily needs, supermarkets, health centers, etc., etc. If you are working at a business and you need to find out if you are to go into work, call your employer.
That's right.
Small business owners should contact the Commissioner of Police and make a case for them, for their business to be open during this period.
That's right.
And of course, then they can then pass on the information to their employees. And the SR&O will be available later today.
Yes.
For persons to peruse and get more information. Also, there's the NEOC briefing this afternoon where more information will be given and will be carried live on ZIZ TV and ZIZ Online, of course, where persons can ask more questions. So thank you very much. I think that this discussion was very much needed because there are lots of details and lots of questions that arose following the speech last night.
Yeah. Well, thank you very much for having me, and I hope that this has been helpful to all our citizens. We have had this question of some misunderstandings and misconceptions, and I hope I've been able to clear them up and clarify them. So thank you. And I hope this is helpful to all our citizens as we move forward.
And thank you for your time.
Thank you.
I'm Jason Davis for ZIZ TV.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, one people. We are roll up to roll up. Cause no man's alone. Do what's right. Cause I love you. And we're in this together. My sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up, to roll out.
Bless up. Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.